Did you know that some people birth their babies super fast? This is called a precipitous birth, where it starts off with them having a few contractions and then shortly after they're bearing down, saying something like, "My baby just came out." So if you were there supporting this person who just gave birth, would you know what to do to help cooperate with nature's design? Or would you do things that could potentially cause harm to the birth parent or to the newborn? So my name is Andrea. I'm a licensed home birth midwife, and in this video, I'm going to discuss the 6 steps I talk to my own home birth clients about regarding what to do if the baby comes surprisingly fast. So number 1, stop what you're doing. If you're driving, pull over. If you're trying to leave the house, just stop. What is happening right there in that moment requires all of your attention, and it's the best thing for the birthing parent and baby. So number 2, help the birth parent get the baby to the birth parent's bare chest. You can unzip, put the baby right there. Did you know that the birth parent's chest in the immediate postpartum heats up a few degrees to heat up the baby and keep them warm? So number 3 is don't mess with the umbilical cord. So this is the umbilical cord, and it's connected to the baby, and it's connected to the placenta, which is still inside the birth parent. So don't mess with it. Don't cut it. Don't do anything like that, because there's blood that's pumping to the baby that belongs to the baby. 1/3 of their blood is pumping to them from the placenta. So number 4, cover the baby with a towel. Babies are wet, they need to stay dry. It's one of the most important things for them to do is to stay dry. So put a towel on them. You know, if you're driving in the car and you don't have a towel, take off your shirt. You can get a shirt and cover baby with. The point is that they're wet, they really need to stay dry, so keep them on the chest and heat them up. Number 5, help the birth parent get in a comfortable position. Help them to lie down in the car, in the seat in the car. Help them to lie on the floor, put a couple pillows on the floor. Help them to get to a sofa or on the bed, but help them to get comfortable. They don't feel like walking around a lot. They just had a baby, especially so fast. It can be very surprising. Number 6, encourage the birther to admire the newborn. This is a very important step because it actually can help prevent maternal postpartum hemorrhage. And this is why. When somebody gives birth and they're not distracted and they're made to feel safe enough to actually be able to focus on their newborn, something really powerful happens in their body. Their body gets flooded with the hormone oxytocin. This is the hormone responsible for giving contractions in the uterus. So the placenta, which is still connected to the baby, is in the uterus, gets a big contraction, the placenta comes out. The uterus is then able to contract and control bleeding at the site where the placenta was attached. So it is really important that the birth parent and the newborn stay connected and attached to each other. The newborn needs the heat from the birth parent, and they're receiving their cord blood from the placenta. And the birther is getting a supply of oxytocin by being close and connected with the baby. I tell my home birth clients that if a baby comes fast in their term, meaning they're old enough to be born at home, they're crying, and the birth parent is calm and focused on the baby, most likely that's a situation that's a thriving, healthy situation. So it is important to get medical help, ASAP at that time. Either you're going to the hospital or having your midwife come to your home to get postpartum care to make sure the newborn and birthing parent are thriving.